This is Andrew Wolf, and I am going to make a short video about acute respiratory distress syndrome, otherwise known as ARDS. Now, acute respiratory distress syndrome is a disease of lung inflammation, and the inflammation leads to a cascade of events that leads to lung injury. Now, there are a number of different things. The lungs are very prone to injury for a number of reasons, and I'm going to get at that as we talk through this video. Now, the lung inflammation
Method. In this multi-center randomized double-blind placebo-controlled trial, we assigned previously untreated patients with HCV genotype 1 infection in a 3-1 ratio to an active regimen consisting of a single table conformation of ABT minus 450 divided by r-Ombitasvir at a once daily dose of 100 milligrams of ABT minus 450, 100 milligrams of Ribavirin and 25 milligrams of r-Ombitasvir and Dasabuvir, 200 milligrams twice daily, with Ribavirin in dose determined according to body weight, a group A or matching placebo group B. Some full-term infants develop RDS because they have faulty genes that affect how their bodies make surfactant.
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition.
Page 555. What is neonatal respiratory distress syndrome? Neonatal respiratory distress syndrome is a syndrome in premature infants caused by developmental insufficiency of surfactant production and structural immaturity in the lungs. So basically, in this condition, there is surfactant deficiency, and as we mentioned, surfactant is what decreases the surface tension. So if you have surfactant deficiency, there is going to be an increase in the surface tension, which is going to lead to increased work for breathing, and therefore leading to alveolar collapse.
Conclusion. In previously untreated patients with HCV genotype type 1 infection and no treatments, a 12-week multivariate regimen of ABT to 450 Ombitasvir and Dasabuvir with Ribavirin was highly effective and was associated with a low rate of treatment discontinuation, funded by ABBV. Safirid 1 clinical trials .gov number.
An X-ray of a premature baby born at 32 weeks of gestation, grunting after 4 hours of birth, X-ray taken on day 1, RDS or respiratory distress syndrome. Respiratory distress syndrome in premature babies is a common problem. In mature births, a chemical called surfactant keeps alveoli open so that they easily fill with air and work efficiently. Surfactant is made by type 2 pneumocyte cells of lungs, and lungs do not start making surfactant
Discussion. This large international phase 3 trial showed the efficacy of an intervention-free, all-oral antiviral therapy for previously untreated patients with HCV genotype 1 infection and no cirrhosis. In the modified invasions, the treat analyzed the rate of sustained virologic response at post-treatment week 12 among patients who received 12 weeks of BTA to 450. Ombitasvir and Dasabuvir with Ribavirin was 96.2%, a rate that was non-inferior and superior to the historical control rate with Dasabuvir and Ribavirin. This multi-case regimen resulted in a low rate of virological failure occurred during treatment in 0.2% of the patients and relapse after the end of the treatment in 1.5%, which limits the number of patients in whom a drug resistance develops.
Graphs.
Efficacy.
What diagnostic test is indicative of neonatal respiratory distress syndrome? A diagnostic test indicative of neonatal respiratory distress syndrome is lecithin sphingomyelin ratio of under 1.5 in the amniotic fluid. So if it is under 1.5, this is predictive of neonatal respiratory distress syndrome, where if it is over 2, this means that the lungs have fully matured. What are some complications that can arise due to neonatal respiratory
to HVCwith The section we're going to talk about today is from First Aid for the USMLE, Step 1, 2013 edition.
Page 556. What is acute respiratory distress syndrome? Acute respiratory distress syndrome is a life-threatening lung condition that prevents enough oxygen from getting to the lungs and into the bloodstream. What are all the causes that can lead to acute respiratory distress syndrome? Acute respiratory distress syndrome can be caused by trauma, sepsis, shock,
Prone positioning in severe CDRA.
Proning an RDS patient receiving invasive mechanical ventilation in the ICU must be done carefully to ensure safety during the procedure. For the procedure to be successful, it is vital to use trained and experienced staff. The video you are about to watch shows the technique used to achieve the prone position and the return to the supine position. The procedure usually requires 3 to 4 people. One person remains at the head of the bed to secure the endotracheal tube and the ventilator lines. This person coordinates the procedure.